Hey, Dry Mouth Doctor here. We're talking about this case study that we've talked about the upper. We did a little intro, but now I'm going to talk a little bit more about the lower and why does this have 6 implants versus this having 4. If you watch the intro case study video for this case, he has an angulation problem for the dentures to balance themselves out appropriately for use. And it's extremely important to see and notice this before you start building a prosthetic around any sort of situation. You want to better make it the best possible for the patient. Now, I chose to recommend 6 implants on the bottom because he does have a fairly large arch. He has a lot of bone going on down here. And he could get away with 4 implants, that's fine. And I would recommend probably putting the implant in here. And then maybe here if you do 4. So 1, 2, 3, and 4. But his arch is so large, and this is the part that's actually moving. People don't realize that you're not eating like this. You're a one-hand clapper. You're only going from the bottom to hit the upper arch, right? This is the only thing that moves. And so this needs more stability if you can get it. Plus, you have a tongue that kicks it out. You have cheeks that want to kick out the prosthetic. If it's a removable prosthetic, I do removable prosthetics. A fixed one, this would also help balance things a little bit more. And there's a little bit more force, and I see sometimes more fractures and breaks on the lower case, and I definitely see more infections on a lower case of implants as well. So this is why I would recommend for this case that he has it. Quality of bone, he has the space, he has a large jaw, and the benefits outweigh the small investment to add the 2 more implants outweighs the situation of the future of having issues done. Watch the other video about the upper, because the upper I talk a little bit about why I choose not to do 6 implants. So these are things that I think are really important for everybody, whether it's a dry mouth case driven or not. But most of the cases I always see that end up in this situation are home care, home care, home care, plus the drive for medications in our pharmaceuticals almost always cause the dry mouth problems, and coupled with poor home care habits with an increased amount of dry mouth reasons to have dry mouth has caused this gentleman to lose his teeth. He is an active person and he does want to smile and chew again. He's got a lot of life left in him to go, and we're going to take this one arch at a time and move him forward so that he maintains a certain amount of quality of life. And we're going to be as conservative as possible with his case. So, great. Thanks for listening. Talk to you soon.